across the state, more than 8,000 nurses and midwives have walked off the job today.
Nurses and midwives in Dubbo, Bathurst and Orange were among those rallying today to highlight staffing issues in our public hospitals.
Northern Health District nurses are making their voices heard, and the fight is just beginning.
We're not coping and we are struggling. So we're just screaming out that we actually have had enough and we want help.
It's their first statewide strike in more than a decade. Nurses and midwives calling for a 2.5% pay rise and 1-to-4 staffing ratios on hospital wards.
We have staff collapsing on the wards. We have staff crying on the wards, as you've seen today. We're not coping at all.
No one gets the proper care that they need, and it's unsafe.
Yesterday, there was a patient in the emergency department for 100 hours. That's insane.
Workers warning if something doesn't give, it could soon be too late.
We're at crisis point. We have to start thinking of ourselves, or we won't have a nursing workforce to care for the patients in the future, and I'm talking in the near future.
It's an absolute mental and physical strain. We have had so many nurses leave the profession in the last 2 years especially because they just can't do this anymore.
Those working up at Tweed are feeling the squeeze harder than most, losing staff to the more desirable Queensland hospitals.
And conditions over there are so much better than what we have, with our pay, with our education allowance, with ratios and with our salary packaging. It's just so easy. Just go 1 kilometre across the border.
When I moved here 3 years ago, I could not understand how the New South Wales health system was so backward and behind. It was like stepping decades back in time. And the reason you have that is because you do not have nurse-patient ratios.
It feels like we're in a war zone. Nurses are broken. They're tired and they're thinking, how can they keep it up?
If we can afford submarines and offshore detention, we can sure as hell afford nurses.
They want babies counted as patients. Right now, only mothers are included in patient numbers, despite some having multiple babies, many of them needing specialised care.
It just is not fair. It's not fair to us and it's not fair to the women.
Look, it's rough. We're doing double shifts, we're doing split shifts, we're doing a morning shift, going for a quick sleep and then going back and filling a night shift.
We've heard reports of where there should have been 8 nurses on a ward, only down to 2 at the peak of Omicron. 1 midwife for an entire birthing unit.
We're sick and tired of not being treated the way that we deserve to be treated.
With a resolution unclear, further industrial action hasn't been ruled out.
Insisting that they're committed to keeping the pressure on until they're convinced that hospitals and staff are safe.